In the Central Region, health officials are advising residents of the region to reduce the intake of oily foods and excessive alcohol in order to control their blood pressure. The caution follows a health screening exercise which reveals that 3 out of 4 people that were screened had abnormal blood pressure. Speaking at the health screening exercise, Executive Director of the Enyidadumba Foundation, Dr. Madison Adenusa, implored on residents to check what they eat in order to stay healthy. There's more in the following report.
The health officials who are part of the non-governmental organization Enyidadumba Foundation have been screening residents in the Gomoa-Esikuma area. The free outreach program in Gomoa-Esikuma to educate community members on their health is part of several health screening exercises the organization has been putting up to help in the physical awareness of residents. The Executive Director of Enyidadumba Foundation, Dr. Madison Adenusa, the health screening revealed blood pressure-related risk, which sparks a lot of concerns.
One thing that came up or that stood out in today's outreach is this, that a high proportion, about 3 out of 4 adults in this community have abnormal BPs. They have high BPs. It is striking. And so we had to educate them on 1, diet, 2, the need to be checking their BPs frequently, and the need to stick to their BP medications or treatments. Because if they do not do that, they stand the risk of developing complications of hypertension, chief among which is stroke, a very debilitating condition for one to have. They could also have heart failure, and they could also have chronic kidney disease. So this is a point that we have reiterated to the district health administration and also the local authorities in the village here, for them to be harping on every now and then, so that they will take their diet seriously. They will not eat so much salt. They will not put so much additives that I do not want to mention the names for obvious reasons to their food. And then you eat natural food, food that has not been highly processed, that has not been so canned, or food that has not been canned. They are in a village, they are farmers, so they have access to the food that is fresh from the farm. We have encouraged them to eat a lot of those fruits, a lot of those foods and those fruits. We have also encouraged them not to patronize so much of the so-called food for the rich, the fried rices and all that. That has a lot of additives, that have a lot of salt in them.
Dr. Adenusa, who is also a medical officer, reviewed other health checks done by the team.
We also screened the eyes of about 200 adults and distributed about 20 free spectacles to those who needed them. We referred those who needed further care, those who had cataracts, those who had glaucoma. We refer them to higher centers for further care.
Beneficiaries of the screening exercise commended the foundation, expressing their appreciation for the screening and encouraged them to keep up their good work. Abdallah Osman's reports for Joy News.